Thank you so much for joining tonight. Tonight's event, Doctors with Dialogue, or Dialogue with Doctors rather, is another one of the very special events put on by the White Dress Project. It is really just an intimate discussion for all of us to ask doctors questions, share our stories, be inspired, get some guidance and advice on how to handle your situation or get information to pass along to people you might know who are having women's health issues or reproductive issues. One of the big things that we often talk about with the White Dress Project and during these conversations is patient advocacy, advocating for yourself, and you're doing it by joining the conversation tonight. So I'm going to introduce you to the guests in the panel that we have tonight, and I'm going to let you know that one is running a little bit late. Again, she's a doctor. She is stuck in the ER. Life happens. But I want to introduce you first to Dr. Rachel Burvell, the Black OBGYN Project. That's what she heads. Now, she is focused on serving those who are most vulnerable and tackling disparities in medicine. She's the founder of the nonprofit organization Hugs for Ghana, which supports youth philanthropic endeavors. She's worked on quality improvement projects and resource poor clinics in Tanzania, East Africa. Now, she graduated from Harvard University in 2013, where she studied neuroscience, global health, and health policy. Then she went on to Georgetown University in 2015 and the University of Illinois College of Medicine. And that is where she dove deeper into her advocacy and the social determinants of health and helped connect underserved patients in the South Side of Chicago with social resources. So when we talk about being an advocate for your patients, that is Dr. Burvell. Now, she is one of two founders of the Black OBGYN Project. That's an Instagram page committed to educating and promoting anti-racism, equity, and inclusion within women's health and reproductive care. She's also a medical consultant for the University of California, San Francisco's Voices for Birth Justice, and she is also a women's health practitioner for them. So one of the things that we do tonight, you'll see in the chat box, is we'll post people's social media. And you heard me just mention the Black OBGYN Project, the Instagram page. I encourage you to just take a moment, grab your phone, follow that page, and stay up to date with what she's doing and the advice she's giving there. Because again, it's free. Okay, I am seeing Dr. Tia Jackson Bay is here. Welcome. Thanks for taking time out of your busy schedule to join us tonight. Now, Dr. Tia Jackson Bay is an OBGYN and reproductive endocrinologist and infertility specialist at Reproductive Medicine Associates in New York. She attended Vanderbilt University for undergrad, University of Cincinnati for med school. She got her master's of public health degree from New York Medical College and then completed her OBGYN residency at Duke University Medical Center, followed by a fellowship in reproductive endocrinology and infertility at the University of Illinois at Chicago. Now, Dr. Jackson Bay is passionate about reproductive justice and increasing access to fertility care for all through her work with the American Society for Reproductive Medicine and the National Medical Association. She highlights health disparities in fertility care, particularly barriers to care and poor treatment outcomes for Black women. She also mentors the next generation of medical professionals from all over the world. She has worked on various projects in women's reproductive health in South America and in Africa. Now, we do have a patient advocate tonight, and if you're new to the Dialogue with Doctors events, this is the person who is going through the process of really kind of finding out their options. They've also possibly shared stories of their dealings and conversations with medical professionals, and we always invite this person to share their experience so that you know you're not alone in navigating this, and they oftentimes have some insight into helping you navigate this situation better. So tonight's patient advocate is Katira Winfrey. She is a multicultural reporter at Wish TV. She's the first ever multicultural reporter there. She is from Houston, Texas, and she loves getting to know people and telling their unique stories. Now, she's explained that she essentially has combined fibroids the size of a fetus. Her uterus is the size of someone who is 16 weeks pregnant. So she went to see a doctor. This is a situation that you'll hear from a lot of people. We've heard it here at the White Dress Project. She said the doctor was rude to her, and just kind of dismissed her feelings, did not listen to her. You know your body, you know something's wrong. And this doctor is telling her, you know, I don't have x-ray vision, when she's asking about her fibroids, and just being extremely dismissive. You know, one of the things about her story that resonated with me is oftentimes Black women are dismissed by some medical professionals. I'm going to let her tell more of her story throughout the night. But Katira, thank you so much for joining us tonight. Thank you all for joining us tonight. We've got some really great conversations on tap happening right now. So Dr. Brevel, let's start with you. Just talk about your work in kind of closing the health disparity gap, because it is huge. And when we talk about access is a problem. And I think that we're seeing it now, especially with COVID-19 vaccines. We hear a lot about how Black people are hesitant to get the vaccine. And there's an absolutely level of truth to that and legitimacy to that. But I work in news and I go to these vaccine clinics and I see Black people standing in line trying to get the vaccine, and they complain about a lack of access. This is really a problem across kind of the medical professionals. So talk about your work.
Absolutely. First, thank you so much for having me here. You know, I am such a huge fan of the White Dress Project because I think that what you all are doing is providing a space for patients to feel like they are not alone and to be reminded that they're not alone. And I think that's the number one part about advocacy work. All of us here need to create communities and spaces for us to have education and for us to better understand health issues. And when it comes to understanding fibroids, it's a medical condition, a medical issue that's so common, yet it's wrapped with so many disparities, again, unfortunately, along racial lines. I think your question, Adriana, really about what does health equity look like, and my work and my passion for that is such an important one to my even identity and my career as a physician. For me, I became a doctor because I wanted to make sure that everyone had the ability to be healthy and well. When you are not able to be healthy and well, you are not capable of being a functioning part of society. You're not capable of being a daughter, a sister, a mother, a friend, a coworker. You're not capable of having responsibilities because of your health. And I think when it comes to women's health or reproductive health, especially, there happens to be less discussions about what that looks like, less conversation about how that's experienced. And so when something feels like it's going wrong, that becomes a shameful experience, and that further impacts your identity and further impacts the way you function in society. And so ultimately, my role as a women's health provider and practitioner is to give voice to my patients, but also walk them through some of these really difficult and challenging moments. However, access and inequities in this country is a conversation we're seeing every day, whether it's because of social determinants of health and the way that structural racism has embedded itself in our day-to-day lives, whether it's the ways that we can feel confident or not feel confident when we're going to work. Unfortunately, when it comes to reproductive health specifically, the disparities that we see are traced back in history. And so one thing that I talk about a lot, both on my Instagram page and through lectures, is this history of the specialty in and of itself that was based on racist ideologies and racist ideas. We think of Dr. James Marion Sims, who is considered the founder of gynecology. Granted, he did make incredible strides with the field. He was able to bring it from something that was done in everyday households to a medical specialization, but he did so at the expense of enslaved women by using their bodies. And the thoughts and the beliefs that were misguided at the time that he helped propagate, things like Black women were considered strong, or Black women can endure more pain than usual, and really pushing this racism through society, but also almost making it more real and as if it is correct because of his status in society, that has persisted up until today. And I remind people that only in 2016, a study went out in the Proceedings of National Academy of Sciences, really surveying about 200 different residents and medical trainees. And over half of these trainees still believed a myth that Black individuals could endure more pain than other individuals of other racial backgrounds. And so when it comes to understanding inequities in healthcare, I'm wanting to correct those type of misguided misconceptions, quite frankly, and to really remind my patients that I hear you, I'm listening to you. I realize that you are couched in a society, a culture, especially here in America, that has a lot of soul searching to do. But I think it's really important for providers to recognize that we have an opportunity to not only address what you're coming in with, but to listen to you and to make sure that as you're heard, we're correcting things that were done incorrectly in the past. So I think that's a very general, almost philosophical answer to your question, but I think it's the way I've operated. It's the reason why the Black OBGYN project came to be. It's the reason why I'm so passionate about my position as a physician, why I love participating in events like this, because I think it's so important to remember that we're all doing this together, but we need to listen to each other in order to move forward.
Absolutely. I mean, definitely philosophical, but you're absolutely right. James Marion performed procedures on enslaved women without anesthesia, and then he would go to Europe and give those white women anesthesia and perform the procedures. And to this day, he is called the father of gynecology. And those women, the enslaved women, you don't hear their names, you don't hear their stories. And I recall that survey that you mentioned where the majority of the residents said that they honestly believed Black people could endure more pain. Therefore, when they go to the doctor's office, to the ER, they're not getting medication for their pain, the same that, their white counterparts are. It is just so fascinating and discouraging. I do want to get to Dr. Tia Jackson Bay and talk about reproductive justice, but I want both of you all to think about, you've done work around the world, and I'm just curious how America stacks up to inequity and equity and access for people of color, women of color, versus these other countries in South America and Africa. But Dr. Tia Jackson Bay, welcome. Thank you for your time tonight. So tell me about reproductive justice, because I think it's so important when you add justice to the advocacy, because I don't think people understand exactly what justice means. It's one thing to say access, it's another thing to say justice.
Hi, so thank you so much for having me as well. Really appreciate the opportunity to speak to your audience tonight. Reproductive justice was actually a phrase coined by a Black woman. And essentially what we mean is that we should include access, but then also care, opportunities. It should be available across the board, that Black women should not be denied the same standards of care. I think especially, call to mind some of the studies that you've mentioned about pain and how we address different medical conditions should not be a different standard of care for one group versus another. And so this actually, is across lots of different lines, across racial lines, across ethnic lines, across, primary language spoken, across geographic location, urban versus suburban versus rural, state to state. And so there are lots of different ways in which certain populations are not being afforded the same opportunities to live a healthy life. And unfortunately for us in the United States, this has been a generational legacy. Unfortunately for us, the color of our skin is the biggest barrier to care. It is not race, it's racism. It's the ability to judge someone just based on how they look before they even open their mouth. And so this makes a big difference in not just our status and quality of life, but in treatment outcomes. Even when we receive the same kinds of treatments, unfortunately, African Americans in this country can have different outcomes. And, there's lots of research into why that is, but a lot of it is actually rooted in discrimination and bias. And so, those are the things that I'm trying to combat at a medical level, both in education of trainees, medical students, but also amongst providers as well, to one, make providers aware of the biases that we all have. There is no way that you live and exist in the United States of America and you don't have biases. It's as American as apple pie. And so just sometimes recognizing that, understanding that, not being defensive, and really just owning it and saying, well, now what? How can we now overcome these biases that we all have? Because I'll say, even as someone who's trained in the medical profession, if you're not aware of it, you can start to take on these biases as well against African-American, Latina, Native American, homosexual, transsexual patients. And so we all have to be able to kind of check ourselves and understand that what we're trying to do is provide a high level of care for everyone, not just for certain people.
So I do want to ask your opinion just on your work. What is the comparison from other countries that you've been in and mentored people there and worked there versus America? Do you see the same level of racism and judgment?
It's a little bit different. And I think because our problem is a uniquely American problem, there are lots of different, the root of all of this is colonialism, imperialism. And so that is very common that you see in many different places across the world. But classification of humans based on how they look. So based on the color of your skin, regardless of, where in the world your family may have originally come from, or, in some regions it's more localized based on an ethnic group or tribe, or language spoken, is very unique. And, even in this country, we think of you're Black. If you have one drop of Black blood, it doesn't matter if your great grandparents, were Black, then you get categorized as Black. And that's something that's actually pretty different and is not widely observed around the world. Now, different countries have their own different classification systems, and they may see disparities based on that, but based solely on color is not something that is common around the world. You may see different, as I mentioned, geography as being one of the most significant, urban versus rural, and having differences in access in that way. Another issue is, we don't have universal health care in this country, and that's something that's different in other places. And not to say that, universal health care solves all the problems, but being able to provide a basic level of health care to all citizens is a huge, step up in addressing some of those barriers to care. The same way we say that all children should have the right to education, we should be able to say that all citizens or all persons residing in our country should have access to basic health care. And unfortunately, right now, we don't have that. And that, again, presents as a huge barrier to care. If people can be denied because they're uninsured, or their insurance is not accepted, or they're afraid of their legal status. These are huge barriers to care in this country.
Dr. Gravel, what would you add to that?
I absolutely concur with everything that Dr. Jackson-Bey just said. I think it's very important for us to not only realize that the United States is lagging behind in healthcare, even compared to countries in Africa and South America, but even compared to our counterparts in the quote unquote developed world. When we look at health statistics, especially when it comes to maternal and infant health outcomes in the UK, Germany, Australia, Sweden, Japan, South Korea, time and time again, the United States ends up with the lowest markers of the morbidity and mortality. And that is really disheartening. I think that what Dr. Jackson-Bey alluded to, this idea that our flavor, so to speak, of racism is very American, is unfortunately a contributing factor to these disparities that continue on in maternal health, infant health, etc. Because from the very basis of the founding of this country, we unfortunately classified people's worth based on what they looked like. And that has not really changed over the many centuries. It's been 4 centuries plus, and yet these different disparities persist. I just finished reading the book Caste by Isabel Wilkerson, and I think that in that book, she does an amazing job of breaking down how race and racism is so embedded in our culture. And because of that, that's why you see these disparities even when you go to other countries. Even though they might have disparities, those disparities oftentimes are because of access or because of infrastructure of the country. But when you come here, our disparities are at the door when you have that access, even before you make it to the consultation room, what preconceived judgments your providers might not have dealt with. I think that what Dr. Jackson Bay also talked about when she referenced biases is huge. Every single one of us, all of us here tonight have biases, but I think it's most dangerous when those biases are not recognized in a professional field where we are supposedly supposed to protect our patients. When a bias persists and we're supposed to protect our patient, what ironically ends up happening is we put our patients at risk of more harm or at risk of a late diagnosis or a misdiagnosis because we're walking in to that consultation room believing that he or she is acting a certain sort of way or will talk a certain sort of way or will adjust to our management and treatment recommendations in a certain sort of way. And that really puts us at a guard when we really should be more open and recognize that everyone is really trying their best for where they are at. And when we recognize our bias, we can really work for the best for our patients. But I think that when comparing different countries, that's where it all comes down to. It's just the way our history has been built in this country, unfortunately.
Absolutely. I always find it so interesting when I do these stories. Medical professionals have always told me it doesn't matter how educated you are or are not. It doesn't matter, where you live, if you live in a nice neighborhood or not so nice, like none of that matters when it comes to bias in this country in the medical profession. It is literally the color of your skin. And I know we all read Serena Williams' story in Vogue, and here's a woman who is financially set for life. Her grandkids are financially set. She's telling you something's wrong and you still don't believe her. What is the deal? I want to get to our patient advocate because I think that, you'll be able to shed some light on your experience when you found out about your fibroids and what your experience was with your doctors. So Katira, I'll let you take it away.
Well, hello everybody. I have known that I've had fibroids probably for the last 10 years. But in that 10 years, every time I would go to the doctor, they would say, oh, that's just a symptom of fibroids. So when I would say I had an issue, it was more of, this is just the life that I have to live. And so it was never really any deeper dive to see how large they had grown or anything like that. And so it wasn't until recently that I finally started talking to a friend, and she said, I had fibroids, I had removal. And so all that tiredness you're feeling, all that constantly having to use the restroom that you're feeling, that excessive bleeding that you're having, the constipation that you're having, all of that is linked to fibroids. And it completely blew my mind. Like, I didn't even know those were things I needed to tell my doctor that I was feeling, because I thought, oh, this is just part of being a woman, or maybe I'm not eating good. I didn't know that all of that was linked to that. And it turns out I was anemic. I was eating ice like crazy. And someone said, you're probably anemic. I had no idea what caused anemia until recently when I found out the excessive bleeding caused it. But essentially, every doctor's visit, it was more of a, well, that's a symptom of fibroids and they're common in Black women. Okay. And so, like I said, I've known I've had them, but I didn't know they were the root of so much until maybe a few months ago. I started feeling firmness in my lower abdomen, but I'm thinking maybe I'm constipated or something. And I really had no clue what to put it together. And so when I finally went to the doctor, and then I'll get to my most recent experience, I went to a recent appointment, and just going back on some of what the doctor said just about residents or students having this feeling. And in that, when you said that, for that appointment, they asked if they would let a student come in the room. And I'm all for interns. So I was like, yeah, the student can come in. But now that I think about it, it was like they were planting a seed to show these students that it's okay to talk to people like this. And when you're in that moment, this is a very uncomfortable situation. Your legs are up in stirrups, someone's talking to you crazy. So your normal reaction is going to be different. At least that was my feeling. So when I said she said, had you ever felt fibroids? And I said, I don't know. I feel a lump right here. And so she presses it and she's like, that's your uterus. And I'm like, okay, I don't know. So anywho, we go through the process. She asked the intern, well, did you see her cervix? And then she does another exam and was like, oh yeah, there's definitely fibroids in there. And I said, oh, wow, can you see them? She said, I don't have x-ray vision. And I said, well, I don't know if they protrude or not. And so at that point, I was done. But because this woman still has me on the table, I didn't feel comfortable lashing out or being expressive, knowing that I wanted to get to the bottom of this. And if I did too much, who knows what she would have done to me in retaliation. So you have all these things going through your mind. But just, it's been a constant dismissal or just brushing it all off like, that's nothing. Well, come to find out, I eventually go back to this same office to get the ultrasound just because now it's so hard to get an appointment. So I said, I can go get this appointment. I don't care if it's an ultrasound, this can't be anything. Turns out my uterus is like the size, like 16 centimeters, I think they said. That lump that I talked about in my side, there is a 10-centimeter fibroid that's growing at the top of my uterus. There's a 5-centimeter fibroid, a 3-centimeter fibroid, and 3 smaller ones inside my actual uterus cavity. The tech told me, you shouldn't be able to feel your uterus through your skin. That's the fibroids pushing it out. And I'm thinking, but that doctor didn't want to listen to me when I said, so I had to go back and meet with that same doctor. And she's like, oh yeah, you have some substantial fibroids. That's the one that you're feeling in your abdomen. And I'm thinking, but you brushed me off when I said it the last time, right? So it's just like, so I finished that procedure. I ended up doing a biopsy that was horrendously painful that I almost jumped off the table. But I got those test results and now I'm like done with that doctor. Now I'm getting all my records transferred to somebody else, but I wanted to get the brunt of the stuff done and just get that part out of the way. But I definitely wrote a complaint to the office because I was like, that's just unacceptable. And I prefaced it with all of the stories that are out about the inequities in the medical field when it comes to Black women. I was appalled that your doctor would treat me like this. And then, I went on and explained it, but oh my gosh, it was a terrible experience. And I had no clue that fibroids could be causing all of this. And at this point, where I'm at now, I can't have children with those fibroids in there. And another thing the doctor told me, she mentioned a couple procedures, mainly they were birth control to control the bleeding, no really procedures to get rid of them, except cut my stomach open or go through vaginally. She didn't mention any other surgeries until I said, well, what about the robotic procedure where they put the things through your lower abdomen? She's like, oh, well, I don't know how to do that. Just because you don't know how to do it doesn't mean you don't tell me that's an option. So I just further knew this is not the woman that I need. So that's kind of my experience in a nutshell. So I'm looking forward to getting to the bottom of this and getting some normalcy back in my life, because the fibroids have definitely taken a toll on me with the excessive bleeding and the constant pain.
And I just, sadly, your story is so familiar, especially here at the White Dress Project. I mean, I hate to hear it every time I've heard it. And I hate that you went through that. And I think that your story, more than most that I've heard, really gets to the heart of how dismissive doctors can be toward patients. I am glad that you have the constitution to be within your mind and know, like, I'm vulnerable. I'm up here spread eagle. And so we're going to have this exchange, but I'm going to complain about this. I'm going to let them know that this is unacceptable, because it is. And so you're in the process of finding a new physician.
Yes, I had another reporter friend who used to work in this market who sent me some suggestions of doctors to try out. And so that particular doctor is on a medical leave, but he has another doctor that he highly recommends. And so I'm not slated to go to her office until May 13th, but my plan is to just keep calling and see if someone cancels or something like that. But it makes me feel good because this particular lady had opens galore. So I'm thinking if she had that much availability, that's a problem. So if a doctor is booked and busy, they must be a good doctor. So even though there is a long wait, I have a little bit more confidence that, okay, maybe this doctor knows what they're doing, that people are going to them to the point where they're booked out that far away.
Yeah. And we at the White Dress Project, it's all about talking and exposing, fibroids are a thing, and sadly they are common and they are normal, and that they happen. But this is my experience. This is my friend's experience. This is what, so that everyone kind of knows, because I was in the same boat with you. Like, I didn't know where all of this stuff was coming from. I hadn't heard of fibroids, I hadn't linked it to anything. So the more you know, the better. And the more you share your story with the next person, the better for them. And the more, when you go to your next physician's office, you'll know, this is what I need to ask. One of the things I've learned with the White Dress Project and all of the events that they put on is your doctor shouldn't make you feel defensive about sharing your experience. The last event that we did with the Morehouse School of Medicine, there was a doctor, Dr. Lippman, out of Atlanta. And, Tanika and Kim and Nikki, I know you guys remember this, but he was just very passionate about your quality of life shouldn't be miserable. And when a woman comes to him and says, I'm bleeding through sheets, I'm bleeding through, pants, I'm bleeding through this, and this is a white man, he's like, I listen to that and I help them, because he knows, that is not normal and that is very real, and that is not the life that you should be living. So I am hopeful for you that you will find someone who listens to you. And I think that that's really the key the next time you have a consultation is, I have this fibroid, these are my symptoms. And if their reaction is, well, sorry, then you already know it's over and I'm not paying a copay. I'm leaving. You know what I mean?
Yeah.
Okay, so I do want to hear from both of the doctors. When you hear stories of this, for me, it breaks my heart. What's your reaction?
Yeah, I agree. It's completely heartbreaking. It's embarrassing to me from the medical field that would be the response of any professional to any person who comes into your office seeking, maintenance care, seeking, treatment for a specific issue, a known issue. Just because something is common doesn't mean that we don't continually investigate it. And I specifically like your point about, the doctor's comfort with, a procedure, or, it really is our duty to kind of stay on top of what's available to patients, some things that are new. We are continually asked to kind of increase our training year by year, increase our knowledge, information, different things that we have to do to maintain what we call board certification. And so just because you don't do a procedure, I refer patients all the time. Okay, that's something that I don't do. I have colleagues here, or I've asked around, or, try these phone numbers, or, even sometimes I'll talk about why I wouldn't recommend to do that procedure. And these are the reasons why. And so, just because that's not personally something you do isn't mean that you shouldn't discuss it or offer it as an option. And we are kind of morally and ethically obligated to say, okay, I don't do that. This is somewhere you should go. And so, it's definitely, it's disheartening. I say that, part of advocating for yourself is what she's done, just to, one, know that you do have the power to switch doctors. And, I do tread lightly on that because I do understand that some people are, limited in who they can see based on insurance and based on finances, based on just location. And so, you don't have to feel that you're doing yourself a disservice if you cannot change doctors, but that is always within your right. You can find doctors, you can go based on your insurance company to find a list of doctors and do the work that way and always change. Know that you have that option. Even if you're inpatient, if you're admitted to a hospital or seen in an emergency room and you are not having a good interaction with your provider, you can ask to be seen by a different team and they have to accommodate you in that way. Another thing is, I kind of like the buddy system. If you're dealing with something that's, complex, or you feel like your doctor is not hearing you, or you're just kind of unsure and need some additional confidence, one, you can write down some questions in advance. It's best to kind of keep it focused. And so maybe if this visit is going to be about the fibroids, and these are going to be my fibroid questions. But it's totally fine to stay and age. We take our phones with us everywhere. Jot down some questions in your phone just so that you can have something to refer to. Maybe let the physician know in advance that this is a meeting about this issue and I'd like to be able to have time to answer questions. Is the doctor going to have time to answer, or should I reschedule an additional visit? When I mention the buddy system, I mean, and particularly for, pregnant women or someone who's maybe involved in some more complex care, bring someone with you if you're able. I know now during COVID times, it's very restricted, but you can have people on video chat with you, on FaceTime, on speakerphone. If you're comfortable and if you, give permission for them to be involved in your healthcare in that way, just to be able to have someone else who's hearing things, making sure that your questions are getting answered, making sure that they both understand what is being told and what's being recommended, and just, for your own additional comfort as well. And so those are some of the things that I definitely recommend in terms of trying to advocate for yourself in some of these difficult circumstances. One is to definitely know that you have options, okay? And so to remember that may be a different provider, a different medical practice, different treatment options. But above all, don't let these situations discourage you from seeking treatment at all. Do the best that you can to maybe find somewhere else through networks like this, find out who may be a better match for you.
Yeah, the buddy system is such good advice. Dr. Gravel, I'm going to kind of change the question for you a little bit. Do you find that your colleagues sometimes, if they don't know, they simply don't share?
I think in a training environment for myself as a medical resident, the expectation is that you are always supposed to ask and let the patient know. I will, confer whether this is the right treatment plan or whatnot, and talk and conference with your colleagues. It's the expectation. And I think that in training, the hope is that by developing that habit, when you become an actual attending in the community, you're able to ask your colleagues questions if you don't know something, or if there's an opportunity for them to receive better care. So in the case of Katira, when her physician didn't know how to do a minimally invasive procedure, her physician would have the insight and capability to say, I do not know how to do that. That doesn't mean that I'm a bad doctor for you, but I do want to make sure you are in the best hands. And I can refer you to someone who has more expertise because their training let them go to that direction. So I think that it's a little bit of both. I think that obviously what happened to you, and unfortunately this happens to other patients, is not normal and it's not right. Medicine should be a conversation. I think Dr. Jackson Bay made so many recommendations, having a buddy, writing your notes in advance, especially when you're in that vulnerable moment. You know, your legs are up in the footrest, your mind goes blank, you don't remember where you are. You're like, why am I even here? I'm embarrassed. But then you remember, I wrote all my questions down beforehand. You know, advocating for yourself, knowing that you can find a second opinion. But also as providers, we need to recognize and remember that, just like we did in our training, you know, as a resident, when we said it's okay to say, I don't know, be honest about it, that we also need to continue that for the best of our patients. I'm really proud to say that my mentors and my colleagues that I work with directly are incredible, and that they have recognized that we are continually learning and we all have the same mission of doing the best for our patients. But I know that that message needs to be emphasized time and time again across the board and across the country for all providers.
So Katira, I won't ask you the race or ethnicity of the doctor that you saw, but I am just curious because, you know, we do have these studies and surveys out there. And I know, frankly, it's kind of a rule that I've always lived by. I typically seek out a Black doctor, be it a man or a woman, but, you know, typically it's a Black doctor. I go to a Black dentist, a Black dermatologist, a Black OB, a Black gynecologist. I mean, it's just, I guess I always have felt safer. And in fact, you know, my story with fibroids, when I went for just a routine checkup, my regular doctor wasn't there, and a white woman doctor saw me. And mind you, I had a huge fibroid as well, 8 by 10 by 11 centimeters. And it was visible when I laid back, my uterus was enlarged. And she was like, well, you know, if it's not really affecting your quality of life, then we can just leave it there. Mind you, I'm of childbearing age, and all of this. And so, you know, that experience, I was kind of like, well, maybe I'll stick to all my Black women, men doctors. But I'm curious, Katira, are you seeking out your next physician based on solely their expertise? Does that ever kind of play a role in your mind, race? And then Dr. Tia Jackson Bay and Dr. Burvell, I'm going to ask you both, you know, your white colleagues, your Latino colleagues, how are they coming to terms with their bias? So Katira, I'll start with you. Is you know, seeking out your next physician based on race and expertise a role in your mind?
Generally, my you know, my choices are just women doctors, period. I've never really thought about, oh, I want a Black doctor. They've always been just women doctors for intimate stuff like that. I just have always felt comfortable. After this incident, I did look up a Black doctor, but right before my appointment, it was canceled. So I was holding on to the next appointment with the other doctor just as a what if, and good thing I did hold on to it so that I was able to get the ultrasound. But for a procedure, I also want to go with expertise, someone who's tried and true. And in my career, and you probably know, I've lived in some really small places, some small towns where the pool of diverse doctors was really small. So it was more of a let me get in here. Now that I live in Indianapolis, there is a broader pool, but their Black doctors are booked and busy. So when I found Black doctors, they've had long wait times because the doctor that canceled, now my next option isn't, it happened early this month. Now I'm set for early April. So I have all these random doctor's appointments to see if they can work. So it's, I do seek out women doctors, and Black doctors are always great. But like I said, living in these places, it's been hard to find diverse pools. Now, even if they aren't Black though, maybe I'll find an Indian doctor, or maybe I'll find a Latino doctor, or another doctor that represents a racial, ethnic minority group that I would feel somewhat connected to. But as it stands, it's just difficult. In the past, it's been difficult. And now I'm back in the, you know, I have good insurance finally, that I have more options also in that regard. But my search for Black doctors, I don't always get that though.
Yeah, you touched on like so many issues of reproductive justice between the geographical access, the insurance, and having better options with that. You know, whenever we do these, I'm just amazed that Black women are as resilient as we are, considering there are so many barriers kind of in our way. So Dr. Burvell and Dr. Jackson Bay, I want to ask you both, you know, what is the reckoning happening right now in the medical profession with doctors who aren't in the minority interacting with minority patients? Are people more aware? Are they asking you more questions? Are there safer spaces for, you know, them to come to you and you to give some advice?
Absolutely. You know, first, I do want to recognize that racial concordance in medical care has incredible outcomes, meaning that if you are a Black patient and you have a Black provider, you are seen or you feel like you're being treated better, and the health outcomes are oftentimes more beneficial. That being said, it is incredibly difficult to continue having racial concordance when we recognize and realize that in this country, 5% of physicians are Black, 6% of physicians are Latinx, 1% or less of physicians are Indigenous or Native American. And so it becomes almost absolutely unrealistic for each and every one of us as Black people or as people of color to find a provider of color, or to not have a long waiting time, as was alluded to see this provider. So it's so important for our colleagues, our non-BIPOC colleagues, to have cultural competence, is what I refer to it as, meaning that you have to be able to recognize what your biases are. I think in light of all of 2020, from COVID-19 uncovering these drastic disparities in health outcomes for Black and Brown populations, to the unfortunate killing of Ahmaud Arbery, Breonna Taylor, George Floyd, I think that society as a whole is coming to terms with this new reckoning, so to speak, that we still are quite racist in this country. And I think that as such, medicine has followed. In August of last year, our accrediting bodies in obstetrics and gynecology, so the American College of OBGYN, amongst what other organizations, put out a statement finally declaring racism as a healthcare crisis and a public health threat, which is a huge stride. But if you consider that it took really the shaking of an entire country to get there, that's where the shock comes in. But I also have to say that I am proud that at least my white colleagues, my colleagues that are not of color, are coming to terms of the privilege that come in spaces that they occupy, and how that might not be shared with the patients that they are treating. Many curriculums around the country in medical schools are now, especially with the change to telemedicine and Zoom classes, are trying to figure out a way to become more culturally competent, how to develop an anti-racist framework and structure. I myself, for example, have received a grant from APGO, which is the professors of gynecology and obstetrics here in the country. They kind of do the curriculum for all OBGYN residencies. I received a grant to work on an anti-racist curriculum. So that's something that I'll be putting out hopefully later this summer and presenting on at their conference next year. So there's a lot of energy, there's a lot of conversation, and a lot of respect and recognition that this makes a difference, that for every single patient here, we need to listen to you, but we need to take our cultural competency, which is just being aware of the racism that's been embedded in medicine, and elevate it to a cultural humility, which is when we hear your questions, when we're doing your exam and we see that protruding abdomen, instead of making a presumption, we say, hey, has anyone told you that this is your uterus right here? Oh, do you think this is normal? Instead of assuming or saying this is normal and leaving it at that, or instead of assuming that you don't want to do anything about your fibroids, asking, are your periods heavy? Are you having challenges with incontinence or bulkness or pressure? And if not, great. We don't necessarily have to do something. But if so, why don't we do an ultrasound? And if it's something that's in the cavity, maybe that's why you've been having challenges getting pregnant all this time. So us asking questions, being vulnerable, that ability to go from cultural competence, anti-racism to cultural humility allows us to have better interactions with our patients. And I think that this is the time that people are realizing that it all is connected, but it's taken obviously a lot of wounds to get there, but I'm glad that we're there.
So anti-racism, cultural competence, cultural humility. That's the latter. That's good. I love it. I love it. And I'm very much looking forward to your anti-racism curriculum. Dr. Jackson Bay, I want to hear from you as well. What are the conversations that you're having with your colleagues? And, I think it's an important note that Dr. Gravel brought up, the pool across the country of BIPOC medical providers is not going to correlate directly with the population of BIPOC people. My mom always teases me about going to only Black doctors. If I have to go to the ER, I can't be like, it's just whoever you get. So are you also having these conversations, and are you exhausted of them yet?
I think I've been having these conversations since I was in elementary school. And yes, it is exhausting, but we soldier on. I think I feel very passionate about helping doctors to understand that this is a real issue. There was recently a podcast that was both created and then very shortly publicized on the Journal of American Medical Association that was disputing the presence of systemic racism in medicine. And to be very honest with you, I thought it was a joke initially. I thought it was being sarcastic as a way to draw in more readers or listeners to the podcast. And unfortunately, it was not. And so it's some way, somehow, this podcast made it all the way through, idea to, a recording, and then also being publicized that was challenging in the year 2021, that racism it could exist in medicine because doctors are not racist. And I mean, you could have knocked me over with a feather, but then I also was like, sure, like eating popcorn, because this is, to my experience, this is the challenge that we're facing. How do you convince, people to solve an issue that they don't think is actually an issue, that they don't think is actually a problem at all? And so this is actually one of the biggest challenges. And so there has been a lot of recognition in the medical community about, okay, something needs to be done. And I'm really encouraged that there's so much happening at the level of medical training, because this is where, the next level of providers, clinicians, nurses, dentists, pharmacists, all healthcare providers, just as, our patient advocate mentioned earlier, to invite a student into the room and then to talk to a patient with disrespect is showing them that that's okay to do. And that's where we actually have to kind of nip this right in the butt. And so, there's so much energy at the level of training, but then we have providers out there in the community who aren't engaged in that much training, who work on their own, and, have other views and experiences outside of medicine that inform how they practice medicine. And so that's been a big challenge into how you can kind of get through. In my field, I think, we have our own unique challenges in terms of, racist ideas and biases against women and couples from different backgrounds. We talked about J. Marion Sims and, unfortunately, his work and how racism is kind of interwoven with American gynecology, and that, unfortunately has bad impacts on reproductive medicine to this day, thinking that Black women are hyperfertile, that Black women can't be infertile, that, they can't afford infertility treatment, and therefore, why would I refer them anyway? That maybe they, all of your Black patients have fibroids, so why would they be bothered about also having fibroids? And so these are some of the different things that, we really work hard to combat at the physician level, and also to make sure that trainees are not adapting these thoughts and practices going forward. We talk a lot about having access and having more physicians available, but I think, one of our kind of strategies to go along with that is to make sure that the physicians who are on the ground are able to address care for everyone and not just for certain populations. Really challenging these biases is going to be a big cornerstone.
I read an article about that podcast on JAM or JAM.
There's a real thing.
It was horrible. And to make it even worse, JAMA is a well-known medical professional journal. And the person who was saying systemic racism does not exist was like a leading voice at the network. And then you have all of these other associations in the medical world saying racism in medicine is a real thing. And then this guy is saying it's not, which again goes to the heart of how dismissive some people are to all of the Black people who are telling you our experience. And you're just saying that, it doesn't exist. As we've said, Katira, I just think you did a great job advocating for yourself and still are advocating for yourself. But I want to ask, the three of you, both of the doctors and Katira, what is your advice for Black women, and how can we change the narrative of advocating for yourself and giving women confidence? I think one of the things that, we take for granted is a patient goes to a doctor because you are the expert. So what you tell me, you went to school, you took out student loans, you studied, you've been in school for 12, 15 years. I trust that what you're telling me is the truth. How do we change the narrative and give Black women the confidence to question the expert, to say, thank you for your time, but I'm going to go see somebody else, or thank you for your time, but there's another doctor in the office I want to talk to? How do we change that narrative and give them the confidence? Katira, since you're unmute, I'll start with you.
Well, I would say that one of the biggest things for me was being able to talk to my friends or talk to other women about it. I think some of these conversations are uncomfortable. You don't want to talk about how much you're bleeding. You want to talk about your uterus health with people. But I think back to a show, Bridgerton, where she didn't know about sex, about reproduction, because her mom didn't talk to her about it. And a lot of us don't know about these because maybe our moms didn't experience it, our aunties didn't experience it, but making it not so weird to talk to your friends like, girl, are you bleeding through your past? And so I think you kind of keep those conversations to yourself because you don't want to feel like, oh, what's wrong with her? Why is she bleeding like that? So I think one of the biggest things in this process for me was deciding that I was just going to tell people about it. And when I started telling people about it, people were like, oh, I'm so happy you post that because I'm experiencing this too. So what was your fibroid experiences like? Oh, I'm going through that too. Or I had a friend, I got fibroid removal and it changed my life. And I'm like, all of you guys experienced that. So I think being able to advocate for yourself is part educating yourself through other women's experiences. I don't think you have to always have the medical background, but I know if that stove is hot and I touch it, I'm gonna get burned. So even though you can't tell me why medically that's the case, you heard it before, somebody did it. And so I think just being open to other women about your experience, you may open a door for them to let them know, well, oh, there's treatment for that? So that was the biggest thing for me in this process and getting it going.
Yeah, absolutely. That's why, the White Dress Project is all about talking and sharing stories, because that's, I feel like, how most of us learn. I was shocked when I told my mom I had fibroids. She was like, oh, I have them too. Why didn't you tell me they existed? Like, hello, open your mouth and give me a heads up. So I think that, you know, Black women do ourselves the disservice in that we aren't open with our reproductive health. And sadly, it's not anything to be ashamed of, but I think sometimes we are ashamed of it. So Dr. Brevel, I want to ask you the same thing. You know, how do we change the narrative? How do we give Black women the confidence to say, I know my body, I'm telling you what my body is doing, you're being dismissive, I'm going elsewhere?
Absolutely. I think for me as a provider, and this is what I talk about all the time with my colleagues and my friends, it's leaving space and leaving room for conversation and questions. You know, I think there was a study in 2012 or 2013 that was looking at physicians and their interactions with their patients. And they found that on average, a physician would interrupt his or her patient within 11 seconds of that patient talking and explaining their medical concerns. And I think if you think about 11 seconds, you just time yourself. You time me talking for 11 seconds and see what type of information comes out of my mouth. You probably don't even get anything out of my mouth within that time. And so I think it's so important for us as providers, number one, to allow there to be a dialogue that not only builds a relationship with your patient and builds rapport, but it makes that visit so much more enriching because we're able to get down to the nitty gritty and answer those questions. But I also think that as a patient myself and as a Black woman, it's so important for us to be willing and open to being educated about things that are a little bit scary to us with our reproductive health. And again, echoing what's been said, talking to our communities. You know, I think we love to say that Black girls are magic. And we, you know, on my Instagram page, I'm always, because I'm a proud Black woman, I'm always highlighting and illustrating our incredible resilience and our nature. And I think another thing that comes with that is our ability to have communities, to have friend groups, to have these support systems in place. But I think that you are absolutely right. We do ourselves a disservice by not talking and extending the conversation to aspects of our reproductive health care. And again, just one last thing that it reminds me of, I remember listening to a podcast a couple years ago. The podcast was called Bodies, and one of the episodes is specifically about fibroids. And it was an African-American woman talking about her experiences. And in her story, she mentions that when her periods became heavy and she started bleeding through her pads, she would put multiple pads on top of each other, and she would just bleed through them. She thought it was normal. And she never talked to anybody about it. She never mentioned it to anybody about it. And because of that, she kind of went through life until she hit her 20s and 30s, and they were still persistently heavy and increasingly painful. She went through life thinking that that was what was a period. But if she had talked earlier to her friends, her colleagues, even mentioned it to her family members when she was going through those quote unquote changes, you know, we always talk about the change, these chapters of reproductive health, it would have opened up a dialogue of, hey, maybe that isn't normal, or hey, that happened to me and this is what I did. This is who I saw and this is what happened next. So I think it's a matter of taking away the shame. It definitely is an uncomfortable conversation. I'm not going to lie to you, but I think that slowly we realize that there are communities just like this, there are providers just like me and Dr. Jackson Bay and others who are willing to listen to you, to provide space and room to hear your grievances that when you have them, and also hear the jubilation when things go well, that we're here to make sure that you're healthy and well. So I think that's what I would really tell my colleagues, tell my friends, tell my girlfriends, tell myself is, number one, make sure that you have a provider who leaves room for you, and also don't be afraid to use up that room.
Yeah, you bring up a lot of good points. I know my daughter had allergies and I took her to the allergist, and it was an Indian man. And he said, okay, so you gave me the diagnosis, told me what you're seeing. I'm going to tell you my thoughts, and then I want you to ask questions. I didn't really know what to ask, but he sat there. He was like, think, ask me something. I'm here for this ask. And I really appreciated that. And I said, well, this is a stupid question. He said, no, it's not. hadn't even heard it. He was like, nope, just ask. That's what I'm here for. So Dr. Jackson Bay, I just want to know your thoughts, on the same topic. How do we give Black women confidence? And, do you think that women in general should be concerned about hurting feelings? I think that we sometimes don't want to be rude or don't want to be hurtful. Do you think that that kind of gets in our way?
I would say pretty universally though, and this can be kind of rooted in different, cultural practices too, is that doctors are kind of held on this pedestal. And so what they're saying must be true, or, you don't question it or you don't challenge it. And so I would say it's okay to ask questions. I mean, I feel the exact same way. I want you to ask questions. I want you to feel informed. I really make a big practice out of busting stigma. And so you need to know that you're not the only person going through this. You need to know that there are lots of different ways that so many different conditions can present and can affect your life, and that you're not the only person, the first or the last, to be sitting in my office discussing this topic, whatever it is. And so that's I think stigma, I think shame around some of these issues as well. Sometimes you just think it's normal because it's normal, but you have to remember, have indoctrinated a shame about womanhood, about reproductive health, about women's parts. We don't even use normal names for our normal body parts. And so that is something that can actually prevent these conversations from happening within families, for example. Your example that you gave about your mom having fibroids and not telling you until you found out is so common. And I see the same a lot in the infertility world. And so really doing everything that you can to kind of recognize that within yourself. It might also include, seeking therapy to, help you to deal with, not just shame and stigma, but sometimes trauma from these experiences. I think just existing as a Black woman in America and in a lot of places around the world just can really, ingrain thoughts in your mind that, inform other behaviors and actions that you take. And it doesn't have to be that way. And so that's something that I always, want to remember to mention, is that there is a certain level of undoing, and some of that may need to take place in therapy. But I love it. I love the idea of community. I think it's so important. When I was a medical student, I met a wonderful group of friends. There were 4 of us, and we actually spent about 2 months together in Ghana, treating and learning as we were still students. And so funny, I don't even remember how the conversation came around to it, but we found out and disclosed that all of us had uterine fibroids. Now, we weren't a 1 in 4 kind of group. We were a 4 in 4 kind of a group. But even just something like that, where we were able to talk about it. And then over the years of being friends, talked about treatment options and issues that we've had. And, what did you do for this? How did you monitor what, oh, this one had surgery, and we were able to support her through that. And so, those kind of conversations can really just open up so many more possibilities, can really kind of break those, bounds of fear and anxiety over the diagnosis or even over treatment options. Because I think that also, some patients are just afraid to act because they don't know anyone else who's ever done that, or they may have a bad experience with the doctor and therefore they avoid doctors going forward. And that's kind of the opposite of what we would want you to do. We want to be able to keep you engaged. And as we've mentioned several times, that may mean, seeking care somewhere else, but just not to carry this whole burden alone. Just to, make sure that you're engaging with a community, with your friends, with your family, perhaps with a new provider, to get the quality of life that you need.
Okay, Dr. Jackson Bay, while I have you, there is a question in the chat. And so I know that you don't know this person's personal medical history directly. So the question is, she was informed that because of the size of her fibroid and the notion that she wants to have children, the only procedure that's available for her is an open myomectomy. Now she's asking, is this the only option? Now I know that you haven't seen her ultrasound or MRI or anything. But I'm going to frame the question in that, how much research should a patient do? There's open myomectomy, there's laparoscopic, there's UAE, there's all kinds of different treatments.
Mhm.
Do you just take one doctor for their word of, nope, this is it, this is all we can do? Or do you maybe see a second or a third doctor with the information that you have? How do you handle that?
I agree. I am big on second opinions. If you don't feel comfortable, if you're unsure, if you want to just hear it from a different perspective, see another doctor before signing your name on a dotted line. Now, yes, there could be, if you had a relationship with a physician, you trust them, you know their skills. There are lots of situations where open myomectomy is the best option. So I don't want people to automatically think that just because they're being told that they'll have to have a scar, that's bad. Some fibroids are big, and the safest way to remove them and to remove the rest of the fibroids may be open. And so that is an okay treatment option. But before you arrive there, if you want to hear all of the different possibilities, if you want to know, well, why isn't a robotic, surgery good for me? Or yes, I do want to have children. What would be, some of the things that I need to know before going into a myomectomy? That's okay. And again, it goes along with advocating for yourself, with asking questions, with seeking out care. It really does pain me that healthcare in this country is like a part-time job. You have to schedule things, and you have to call, and you have to call your insurance company. Trust me, your physicians are just as frustrated. But, when it's something that's as important as uterine fibroids, as endometriosis, as, reproduction, if you have it, if you have the wherewithal to do it, sometimes you may say, okay, I'm a teacher and I have my summers off. Let me go, hard in the summer, or, after I meet my deductible, then I can seek out more, specialty care, whatever that time frame may be, or the situation may be for you. Often it's worth it to just kind of dedicate the time and energy that you need. So I'm big on second opinions, third opinions. That's fine. I don't think any doctor would, discourage you from that. And you also don't have to tell your doctor. It's your own body. It's your own business. You can go where you want to go, and then you can maybe circle back and say, okay, I've seen people, I've heard this, I've heard that, and now I'm ready to act.
Right. And I can just say, in my personal experience, the gynecologist found the fibroids and said, you're fine. Leave it. And it was my mom who said, see a fertility specialist. And I went to a fertility specialist, and she was a white woman. She said, I have fibroids, I had them, and I'm going to send you to the doctor who did my surgery. Turned out to be a Black woman, which, for me, I was like, yes. But she was like, no, we're not just going to leave fibroids in your body. This is not something that we're doing, especially if you want to have children. The surgeon who did the surgery, she did have a specialization in fertility as well. And so that was something for me when she was telling me what was happening and what her plan was. I felt more comfortable because I felt like she was taking into consideration a lot of different things. So if you have been to one of these Dialogue with Doctors events before, I have a really big problem staying on time. However, tonight I am doing super well. So I'm going to wrap up there. If you'll notice in the chat, there is everyone's social media handle. Connect with the doctors, connect with our patient advocate, because if we said all night, talking, being open, sharing experiences, that's how you get more information. And that's how you're better equipped to advocate for yourself when it comes time to make these really important life-changing decisions. So I encourage you to follow everyone on social media, the White Dress Project at We Can Wear White, Dr. Tia Jackson Bay at Dr. Tia Jackson Bay, the Black OBGYN Project at Katira_Winfrey, and I'm Adriana Hopkins. And we're all, here to answer whatever questions and share our experiences with you. So with that, Tanika, I was told to toss it over to N Kim, and it looks like maybe she stepped away.
Hi, ladies. Oh my goodness. I am like so full tonight. Have you guys seen that meme that's like the Kermit the Frog is like typing at the computer? That was me like writing all the notes, because we definitely got a history lesson tonight. We got a lesson in advocating for yourself. We also got one of the lessons that I love the most, which is about community and finding your tribe and a buddy system, and knowing that you don't have to go through managing life with fibroids on your own. Dr. Bevel, we are so, so honored to have you. We have been following you for such a long time. So when you said you're a fan of ours, my heart palpitations. So thank you so much for being here. Thank you for sharing so eloquently and honestly just about our history. And, you know, a lot of times if we don't know our history, we don't know where we're coming from and or where we're going. So thank you so much for touching on that this evening. Dr. Tia Jackson-Bey, thank you so much for just your transparency and being so honest about what is happening in the healthcare system and how we can really be our best health advocate, because that's really what we try to promote at the White Dress Project, making sure that every woman knows that they are their own best health advocate. And while doctors may have good intentions, sometimes they don't serve us in the best way. So it's important that we become our own best health advocate. And Katira, I would love to connect with you. Your story and the way you share it is so transparent, it's so real, it's funny, it's sad, it's all of the emotions. And I'm just grateful that you chose our platform and our organization to be a part of our community and share your story. So thank you so much. And for everyone who is on the call and who has taken the time just to invest in themselves and be here tonight, thank you so much. We're so proud of the work that we're doing and the space we're holding for people who are managing life with fibroids. Adriana, I say it all the time. You know how I feel about you, and you do this conversation such justice, not only because you have experienced it, so you're speaking from a personal perspective, but you really just have such a wonderful way of making sure that we're getting all the tips. There's in Kim, making sure that we're getting all the nuggets and really just wrapping it up in such a way that only Adriana can do. So we are very, very happy to have you. Ladies, we are continuing with programming throughout the next few months. You'll see a lot of things rolling out from us. You know that July is Fibroid Awareness Month. One big plug that I'd like to say before I kick it to Nkem is that on March 23rd, we are reintroducing the legislation that Vice President Kamala Harris introduced last July, which is the Uterine Fibroid Research and Education Act. And it has gotten a new name. It is now going to be called the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act. And if you don't know anything about Stephanie Tubbs Jones, about 20 years ago, she was the first member of Congress to introduce anything on fibroids. So we are doing this bill in her honor. So we are going to be coming back to all of you to support it because you know that a lot of times issues that impact Black women aren't always supported, right? So it is our duty and as advocates for ourselves to make sure that we are supporting this bill. So don't worry, you will hear a lot about it. And I will be calling on our doctors and our patient advocate really to speak up. And that what speaking up means is, you know, meeting with Congress members. So please answer my phone when I call or when Nkem calls or any member of our board. Thank you all so much for asking questions and showing up for yourselves tonight. We are honored to hold space for you. Nikki, thank you. Always on production, always on the chat, always doing what a great journalist does. Thank you, ladies. And Kim, thank you so much for pulling this together.
Thank you. I'm sure Tanika said it all, but I just really wanted to thank everybody for tuning in tonight. I wanted to thank Dr. Burvell. I want to thank Dr. Jackson Bay, Katira. You jumped in, you stepped in literally like 2 hours ago. Amber was supposed to be the patient advocate, but Amber found she wasn't feeling well, so she was able to get Katera, who stepped in. So I would truly, 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 truly appreciate you for sharing your story, having the strength and the courage to share your story, because you don't know how many people it is empowered. So thank you so much. Thank you, Dr. Ravel and Dr. Jackson Bay, for all of the wonderful insight. I know that from the patient perspective, going to the doctor can be intimidating. They're viewed as authority. They have the medical expertise, they have the experience. So it's like, they know more than me. But I always emphasize the importance of the fact that the expertise of the doctors needs to be held in higher or equal, or the expertise over our own bodies needs to be held in higher or equal regard to the expertise that the doctors have. And we always also emphasize the importance of the fact that the relationship between a patient and a doctor is a partnership. We are collaborators in our care. And it's so important to have the knowledge, to do your research, to know your options, so that we're not completely dependent on the doctors, right? That's part of self-advocacy, knowing your condition, knowing your options, and working together with your physician to come up with the best course of treatment and care for you. So thank you so much, Dr. Burvell, everybody who has participated, who has attended. We appreciate you. We're going to be doing more of these educational events. Thank you, Adriana, always for answering our call and supporting us. And Nikki, we love you all. So thank you so very much. We appreciate every single one of you. So thank you.
And the last thing I just wanted to add is that we are looking for committee members, shameless plug here. So please reach out to us, DM us. We'd love to have you on the Hill with us. We'd love to have you share your story. So please DM us. Thank you.